Hello. Today we are going to discuss on the topic Narcissistic Personality Disorder. In the previous videos we have already discussed about personality disorders and its clusters. There we came to understand that there are three clusters: Cluster A, Cluster B and Cluster C. Narcissistic personality disorder comes under Cluster B. Let's see this in detail. This disorder is characterized by a magnified sense of self-importance, underlying deep self-esteem issues, exaggeration, manipulation, envy, arrogance, impatience and depression. They are very vulnerable to criticism. They lack empathy and exploit others for their personal betterment. Like histrionic personality disorder, it can cause an excessive need for attention and approval. Now let's see the diagnostic criteria of this disorder. A pervasive pattern of grandiosity, need for admiration and lack of empathy beginning by early adulthood and is indicated by 5 or more of the following. First, has a grandiose sense of self-importance. Second, is preoccupied with fantasies of unlimited success, brilliance, beauty or ideal love. Third, believes that he or she is special and unique and can only be understood by or should associate with special or high status people. Fourth, requires excessive admiration. Fifth, has a sense of entitlement. Sixth, is interpersonally exploitative. Seventh, lacks empathy. Eighth, is often envious of others or believes that others are envious of him or her. And ninth, shows arrogant, haughty behaviors or attitudes. Now let's see the prevalence or the epidemiological rate of narcissistic personality disorder. The lifetime rates of narcissistic personality disorder are estimated at 1% in the general population and between 2 to 16% in the clinical population. Males receive this diagnosis more often than females. Talking about the development and course of narcissistic personality disorder, it is seen that narcissistic traits may be particularly common in adolescence and do not necessarily indicate that the individual go on to have this personality disorder. Individuals with this disorder may have special difficulties adjusting to the onset of physical and occupational limitations that are inherent in the aging process. Now let's check out the causal factors. The causes of narcissistic personality disorder are unknown. Researchers apply a biopsychosocial model of causation. Genetic. NPD is an inheritable psychological condition. Research evidence indicates that a person is more likely to develop NPD if this personality disorder occurs in the medical history of his or her family. Environment. Environmental and social factors also exert a significant influence upon the onset of NPD. According to Cohort and Kernberg, if parents are neglectful, devaluing or unempathetic to the child, this individual will be perceptually searching for affirmation of an idealized and grandiose sense of self, which can be a reason for NPD. And according to Bandura, NPD comes from unrealistic parental overvaluation. Now let's check out the treatment regime for this disorder. Psychotherapy. First, we can go with talking therapy, also called psychotherapy. This encourages a person to express themselves verbally to a therapist who will listen without judgment and may offer advice. Cognitive behavior therapy. Usually, this helps a person examine their thought patterns and behaviors and develop practical ways to adjust them. We can also use dialectical behavior therapy or DBT. It can teach people new skills with the aim of making positive life changes. Pharmacotherapy. There are no specific drugs for this personality disorder. However, mood stabilizers, antidepressants, antipsychotics and anti-anxiety medications may improve specific symptoms and can help with co-occurring problems like anxiety and depression. So this was all about narcissistic personality disorder. With this we complete cluster B of personality disorder. In the next video we can discuss cluster C personality disorders. Hope to see you soon with the next video. Till then, take care. Bye.